Hey everyone, this is Dr. Medicine RX, and in today's video we'll be discussing about photodynamic therapy. So it is the use of photosensitizing agent and a light source in order to produce targeted destruction of affected tissue, thereby minimizing damage to normal tissue. Coming to mechanism of action, it acts by photooxidative reaction where the excitation of photosensitizing agent occurs after irradiating it with a light of certain wavelength in the presence of oxygen, and this leads to release of reactive oxygen species, especially the singlet oxygen, which has direct and indirect cytotoxic effect on target cells. Coming to the photosensitizing agents that are used, first is porphymer sodium. It is given intravenously and it produces generalized cutaneous photosensitivity that lasts for months. Then there's 5-amino-levulinic acid, 5-ALA, which absorbs blue light. Then methyl-amino-levulinic acid, MALA, which absorbs red light as well as daylight. Both of these, they form protoporphyrin 9, which is the photosensitizing agent here. Then BF200-ALA gel and verteporfin. The ideal photosensitizing agent should have chemical purity, it should have high reactive oxygen species yield, it should be highly effective, and it should have high tissue selectivity, and it should have a significant light absorption. Coming to light sources, first is laser light. So it is monochromatic, coherent and intense. So those are its beneficial effects, but it can be a bit pricey, and it can be used for small skin lesions. Whereas non-laser lights such as fluorescent lamps, light emission diodes with red-blue emissions and intense pulse light sources can also be used, as well as ambient day sunlight. So wavelengths around 630 nanometers are often used because they have maximum absorption. Coming to indications, so the main indications or oncologic indications for photodynamic therapy, rest all are off-label indications. Even in oncological issues, acne keratosis, acne cheilitis, Bowen's disease and superficial basal cell carcinoma are some of the approved uses, whereas some off-label oncological conditions such as superficial squamous cell carcinoma, CTCL, cutaneous metastasis and Kaposi sarcoma are also treated using photodynamic therapy. In acne keratosis, we use sunlight as the light source. Non-oncological conditions such as localized scleroderma, leishmaniasis, acne, rosacea and HPV dermatosis have also been treated with photodynamic therapy. Coming to the procedure, in the first step, what we do is that we gently scrape the lesion to increase the amount of absorption of drug, and then the photosensitizer agent is applied to the lesion. And this is followed by waiting for a period of 3 to 6 hours in order to allow the drug to concentrate in the cancer cells. Next, in the stage 2, we use a light source, either laser, non-laser or sunlight. If laser or non-laser, then the treatment can be done for a period of 5 to 45 minutes. But if it is sunlight, then the exposure should be carried on for a period of about 2 hours. And these lights are shown onto the treated area. And after this particular time period, we cover the treated area with a dressing in order to protect it from further light exposure if the person is going out or carrying on any activities that involve exposure to sunlight or any other light for that matter. Then in the stage 3, this is characterized by the occurrence of a sunburn reaction which heals within 4 to 8 weeks, thereby causing destruction of the tissue. Coming to side effects, photosensitivity of the treated area, it usually lasts for 24 hours. However, if porphymer sodium is used, it lasts for many months. Then burning or stinging sensation, pruritus, swelling and redness of the area, blisters and peeling, crusting, scarring, loss of pigmentation in the area and skin infections are all some of the side effects of photodynamic therapy. Thank you. Subscribe for more.